What if your breath has been warning you about kidney failure and you have been ignoring it every single day? Before the sweating in your feet, before the exhaustion, before the emergency room, and sometimes even before a person realizes their kidneys are struggling, the body may start sending quiet signals through something you do all day without thinking. Your breath. Not just the smell of your breath, but the way you breathe. How easily you run out of air. How your breathing changes at night. How your mouth tastes. How your body reacts when waste fluid, acid, and toxins begin building up inside you. Most people think kidney failure only shows up in urine tests or blood tests. And yes, those tests are essential. But the body often whispers before it screams. And one of the places those whispers may appear is in your breath. Doctors warn that when the kidneys stop filtering properly, waste products can build up in the blood. Fluid can collect in the body, acid balance can shift, red blood cell levels can drop, and all of that can affect your mouth, your lungs, your energy, and the way you breathe. But here is the dangerous part. Most people explain these signs away. They say, it's just bad breath. They say, I'm just getting older. They say, I'm out of shape. They say, maybe I ate something strange. They say, I just need a stronger mouthwash. And sometimes, yes, the cause may be simple. Bad breath can come from dental problems. Shortness of breath can come from lung disease, heart disease, anxiety infections, or being out of shape. But when breath changes appear together with swelling, fatigue, nausea, poor appetite, changes in urination, high blood pressure, or diabetes, doctors take that seriously. This video is not here to diagnose you. No video can do that, but it can show you what to watch for, what not to ignore, and when to speak to a medical professional. Today, I'm going to show you 9 warning signs in your breath that could mean serious kidney trouble, including kidney failure. For each one, I'll explain what most people think it is, what may actually be happening inside the body, and one practical step you can take. And please listen carefully. If you have sudden severe shortness of breath, chest pain, confusion, blue lips, extreme weakness, or you feel like you cannot breathe, do not wait. That is emergency territory. Now let's begin. Sign number 1 is the classic one doctors are trained to recognize, but most people at home completely miss. A breath that smells like ammonia, urine, or chemicals. This is not ordinary morning breath. This is not garlic from dinner. This is not coffee breath. This is a sharp, chemical, almost urine-like smell that may stay even after brushing your teeth. Many people feel embarrassed by it. They buy stronger toothpaste. They chew gum. They use mouthwash again and again, but the odor keeps coming back. When kidney function drops, the body may struggle to remove urea and other waste products from the blood. As these waste products build up, they can affect the saliva and the air you breathe out. That is why some people with advanced kidney disease develop what doctors call uremic breath or uremic fetor. Think of your kidneys like the filter in a water machine. When the filter is clean, the water comes out fresh. But when the filter is clogged, waste starts staying in the system. Eventually, you do not just see the problem in one place, you smell it, you taste it, you feel it. The important thing is this: ammonia-like breath does not automatically mean kidney failure. Dental infections, dry mouth, certain diets, medications, and other conditions can also affect breath odor. But if the smell is persistent, unusual, and especially if it comes with fatigue, swelling, nausea, itching, or changes in urination, it deserves medical attention. Do not just mask it. Your practical step is simple. If your breath suddenly smells like ammonia or urine and it does not improve with normal oral hygiene, ask your doctor about kidney function testing. That usually means a blood test for creatinine and estimated GFR, plus a urine test to check for protein or other abnormalities. A mint can hide the smell for 5 minutes. A test can show you what is actually happening. Sign number 2 is one of the most commonly dismissed signs. A metallic taste in your mouth with a bitter, chemical feeling in your breath. People often describe this as tasting coins, metal, chemicals, or something bitter that will not go away. Food may taste strange. Meat may suddenly become unpleasant. Water may taste different. Even after brushing, the mouth still feels off. Most people blame vitamins, dental fillings, acid reflux, or getting older, and sometimes those can be involved. But when the kidneys are not clearing waste efficiently, toxins can build up in the bloodstream and affect taste. This matters because metallic taste is not only annoying, it can reduce appetite, and when older adults stop eating properly, they lose strength fast. Imagine leaving a small amount of spoiled liquid inside a bottle. Even if you rinse the bottle quickly, the smell and taste can linger because the source is still there. That is similar to what happens when the blood itself is carrying too much waste. The mouth becomes one of the places where the problem shows itself. This is why some people with serious kidney disease say, "Nothing tastes right anymore." Here is what makes this sign more serious. Metallic taste plus nausea, poor appetite, unexplained weight loss, fatigue, or ammonia breath. That combination should not be ignored. Your practical step: write down when the taste started, what it feels like, and whether it appears with other symptoms. Then bring that information to your doctor or dentist. You want to rule out dental disease, reflux, medication, side effects, and kidney problems. And do not make the mistake of forcing supplements or strange detox drinks to clean the kidneys. That can backfire, especially if kidney function is already reduced. Sign number 3 is persistent bad breath that brushing does not fix. Now, let's be honest, everyone gets bad breath sometimes. If you sleep with your mouth open, skip brushing, eat onions, smoke, drink coffee, or have gum disease, your breath can smell bad. That alone does not mean kidney failure. But this sign is different. This is breath that stays bad no matter what you do. You brush, you floss, you scrape your tongue, you rinse, you drink water, and still the odor keeps coming back. Most people attack the mouth, but sometimes the mouth is only the messenger. When the body's filtration system is not working well, waste can build up internally. And when waste builds up internally, breath odor may become a symptom of a deeper problem. Think of your mouth like a window in a house. If you smell smoke coming through the window, spraying perfume on the window is not the solution. You need to find where the smoke is coming from. Persistent breath odor can be a dental issue, and you should absolutely check that first. Gum disease is common and serious, but if your dentist says your mouth looks fine, yet the breath problem continues, do not stop there. Look at the full picture. Are your ankles swelling? Are you more tired than usual? Are you urinating less, more, or waking up at night to urinate? Is your blood pressure high? Do you have diabetes? Do you feel nauseated? Is your skin itchy? These clues matter. Your practical step: book a dental checkup and a basic medical checkup. Do not choose one or the other. Bad breath that does not match your oral hygiene deserves both angles, mouth and metabolism. Sign number 4 is breathlessness when doing normal daily tasks. This is the one people almost always blame on age. They walk up a few stairs and feel winded. They carry groceries and need to stop. They walk from the bedroom to the kitchen and feel like their chest is working harder than usual. And they say, "I'm just getting old." That may be the most dangerous sentence in health. Getting older can reduce stamina, yes, but new or worsening shortness of breath is not something to casually accept. Kidney disease can contribute to breathlessness in more than one way. One reason is anemia. Healthy kidneys help signal the body to make red blood cells. Red blood cells carry oxygen. When kidney function declines, some people develop anemia, meaning the body has fewer oxygen-carrying cells than it needs. So even if your lungs are working, your body may not be delivering oxygen efficiently. It is like having delivery trucks, but not enough drivers. The oxygen is there, but the system cannot move it properly, so the body feels starved for air. Another reason is fluid. When kidneys struggle, the body can retain extra fluid. That fluid may build up in the legs, around the body, and in serious cases, in or around the lungs. When that happens, breathing becomes harder. This is why shortness of breath should never be brushed off, especially if it is new. Your practical step: if you notice you are getting winded from activities that used to be easy, check your blood pressure and schedule a medical visit. Ask whether you need kidney function tests, a blood count to check for anemia, and evaluation for heart or lung causes. Do not just sit down more and move less. That creates a trap. The less you move, the weaker you get, and the easier it becomes to blame every symptom on aging. Sign number 5 is shortness of breath when lying flat. This one is serious. If you lie down at night and suddenly feel like breathing becomes harder, or you need 2 or 3 pillows to sleep comfortably, pay attention. Most people think it is anxiety, a heavy meal, or being tired. Some say, I just sleep better propped up, but doctors look at this differently. When you lie flat, fluid that has collected in the lower body can shift upward. If the kidneys and heart are not managing fluid properly, that fluid shift can make breathing worse. In some cases, fluid may affect the lungs, making a person feel short of breath when lying down. Think of your body like a building with water pooling in the basement during the day. When you change position at night, that fluid redistributes. Suddenly, the system that felt manageable while you were upright becomes a problem when you lie down. This is especially concerning if you also notice swollen ankles, tight shoes, rapid weight gain over a few days, or waking up gasping. Kidney problems and heart problems often overlap here. The kidneys control fluid and salt balance. The heart pumps blood. When either system struggles, the other can suffer too. Your practical step: do not ignore breathing trouble that appears when lying flat. Call your doctor promptly. If it is severe, sudden, or comes with chest pain, confusion, blue lips, or a feeling of drowning, seek emergency care. At home, one protective habit is reducing sodium from packaged and restaurant foods. Sodium makes the body hold on to fluid, and extra fluid can make breathing problems worse. But do not treat sodium reduction as a replacement for medical care. If fluid is already affecting your breathing, you need evaluation. Sign number 6 is waking up at night gasping, coughing, or feeling like you cannot catch your breath. This is terrifying when it happens. A person falls asleep, then suddenly wakes up sitting upright, breathing hard, maybe coughing, maybe feeling pressure in the chest, maybe needing to walk around to feel better. Some people blame nightmares, some blame stress, some blame sleeping in a bad position. But when this happens repeatedly, especially in someone with high blood pressure, diabetes, known kidney disease, swelling, or heart disease, it can be a warning sign of fluid overload or another serious condition. At night, the body changes position, fluid moves, breathing slows. The lungs and heart work differently during sleep. If the body is carrying too much fluid because the kidneys are not clearing it well, nighttime can reveal the problem. Imagine a sink that drains slowly. During the day, you only run the water a little, so it seems fine. But at night, when the conditions change, the sink starts backing up. The problem was already there. The night simply exposed it. This sign needs respect. Your practical step: track how often it happens. Write down the time, whether you were lying flat, whether your ankles were swollen that day, whether you had salty food, and whether you felt chest tightness. Then speak to a doctor. And again, if you wake up severely short of breath, if you cannot speak full sentences, or if you feel chest pain or faintness, do not wait for a routine appointment. That is not a sleep problem. That is a medical problem until proven otherwise. Now, before we continue, I want you to do something. Have you noticed any of these signs in yourself or someone close to you? Ammonia-like breath, metallic taste, breath that does not improve, or shortness of breath that feels unusual? If yes, type yes in the comments. Not because a comment diagnoses you. It does not. But because awareness matters. Many people ignore these signs because they think they are alone. They are not. And if this information is useful, hit the like button so it reaches more older adults, more families, and more people who may need to get checked before things become serious. Now let's keep going. Sign number 7 is fast, deep, heavy breathing even when you are resting. This is one of the most urgent signs on the list. If someone is sitting still but breathing unusually deep or fast, almost like the body is trying to blow something out, doctors think about serious causes. One possible cause in severe kidney problems is acid buildup. Your kidneys help keep the body's acid-base balance in a safe range. When they are failing, acid can build up in the blood. The body may try to compensate by changing breathing. Deep, labored breathing can be the body's emergency response to a chemical imbalance. Think of your body like a swimming pool. The water has to stay balanced. If the chemicals go too far in one direction, the entire system becomes unsafe. Your kidneys are part of the team that keeps that balance. When they cannot do it, your breathing may try to help. This is not the same as being out of breath after exercise. This is breathing that feels wrong at rest. Deep, heavy, unusual. Sometimes with confusion, weakness, nausea, or extreme fatigue. Do not play games with this sign. Your practical step: if you or someone near you has unexplained deep, rapid breathing at rest, especially with confusion, severe weakness, vomiting, diabetes, known kidney disease, or decreased urination, seek urgent medical care. This is not a sign to manage with tea, lemon water, or breathing exercises. Breathing exercises can calm anxiety. They cannot fix dangerous acid buildup in the blood. Sign number 8 is wet, crackly, or bubbling breathing. This is another sign people often misread. They say, maybe I have a cold. They say, maybe it is allergies. They say, maybe I swallowed wrong. And sometimes that is true. But wet-sounding breathing, especially with shortness of breath, swelling, or sudden worsening, can be a sign that fluid is involved. When kidneys are not removing enough fluid, the body can become overloaded. In serious cases, fluid may collect in the lungs that can make breathing sound wet, heavy, crackly, or bubbly. A person may cough more when lying down. They may feel like there is fluid in the chest. Think of the lungs like a dry sponge designed to move air. If that sponge becomes waterlogged, air cannot move through it the same way. Breathing becomes harder. Every breath takes more effort. This is why doctors take fluid overload seriously. It is not just swelling in the ankles. It can become a breathing problem. Your practical step: if you notice wet breathing, worsening cough, breathlessness, and swelling together, do not treat it as a simple throat issue. Without medical advice, contact a doctor. If breathing is severe or worsening quickly, seek emergency care. At home, start paying attention to daily weight. If you are at risk for kidney or heart disease, a sudden weight increase over a few days may mean fluid retention. That information can help your doctor. Also, be careful with salty foods. Canned soups, deli meats, frozen meals, chips, sauces, restaurant meals, and processed bread can carry more sodium than people realize. For someone retaining fluid, sodium can pour gasoline on the fire. Sign number 9 is a sudden sweet, fruity, or nail polish-like breath, especially with extreme thirst, nausea, confusion, or weakness. Now, I want to be very clear with this one. Fruity breath is not the classic kidney failure breath. The classic kidney-related odor is more ammonia-like or urine-like. But fruity or acetone-like breath can signal a dangerous metabolic emergency, especially in people with diabetes. And diabetes is one of the major causes of kidney disease and kidney failure. When the body cannot use glucose properly, it may start producing acids called ketones. In severe cases, this can become diabetic ketoacidosis, a medical emergency. This condition can cause dehydration, vomiting, confusion, and serious stress on the kidneys. It can also happen alongside acute kidney injury or make kidney function worse. So if someone has diabetes, or might have diabetes, and their breath suddenly smells fruity or like nail polish remover, do not ignore it. Most people think maybe it was something I ate. But if fruity breath comes with extreme thirst, frequent urination, vomiting, belly pain, weakness, confusion, or deep rapid breathing, that is not normal. Think of it like a warning light on a dashboard. You may not know exactly which engine part is failing, but you know the car should not be driven casually until it is checked. Your practical step: fruity breath with those symptoms deserves urgent medical attention, especially in someone with diabetes. If you have a glucose meter, check blood sugar. If ketone testing is available and recommended by your healthcare provider, follow your sick day plan. But do not delay care if symptoms are severe. This sign may not start in the kidneys, but it can threaten them quickly. Now let's bring everything together. We covered 9 warning signs in your breath that could point to serious kidney trouble or a dangerous condition that affects kidney health. Number 1, ammonia urine-like or chemical breath. Number 2, a metallic taste with bitter chemical breath. Number 3, persistent bad breath that brushing does not fix. Number 4, breathlessness during normal daily tasks. Number 5, shortness of breath when lying flat. Number 6, waking up, gasping, coughing, or struggling for air at night. Number 7, fast, deep, heavy breathing at rest. Number 8, wet, crackly, or bubbling breathing. And number 9, sudden fruity or acetone-like breath with symptoms of a metabolic emergency. Here is what I want you to understand. Your breath is not just air leaving your body. It can be a signal. It can reflect what is happening in your blood, your lungs, your fluid balance, your acid balance, and your metabolism. But the biggest mistake is waiting until the signal becomes impossible to ignore. Kidney disease is often silent in the early stages. Many people do not feel obvious symptoms until damage has progressed. That is why testing matters so much. If you have diabetes, high blood pressure, heart disease, a family history of kidney disease, are over 60, or have been told your kidney numbers are not perfect, do not wait for breath changes to become dramatic. Ask for kidney function testing. A simple blood test and urine test can reveal what your breath cannot fully explain. And please remember this: bad breath alone does not mean kidney failure. Shortness of breath alone does not mean kidney failure. But persistent, unusual breath changes combined with swelling, fatigue, nausea, itching, poor appetite, high blood pressure, diabetes, or urination changes should never be ignored. Tonight, I want you to do one simple thing. Pay attention. Notice your breath. Notice your mouth taste. Notice whether walking feels harder than usual. Notice whether lying flat changes your breathing. Notice whether your shoes feel tighter. Notice whether you are more tired than normal. Not with panic, with awareness. Panic makes people freeze. Awareness makes people act. And if you notice something concerning, call your doctor. Ask questions. Request testing. Bring a list of symptoms. Be specific. Say when it started, how often it happens, and what makes it worse. You work too hard for your health and independence to lose ground because a warning sign was dismissed as just age or just bad breath. Your kidneys work quietly for you every minute of every day. They filter, balance, regulate, and protect you without asking for attention. But when they start asking for attention, listen. If this video helped you, share it with someone you care about, especially someone over 60, someone with diabetes, someone with high blood pressure, or someone who keeps saying, "I'm fine," even when their body is clearly changing. Subscribe for more clear, practical health warnings that most people only hear after the problem becomes serious. And tell me in the comments which signs surprised you the most. Stay aware, stay proactive, and never ignore what your breath may be trying to tell you.